and function of the spine and describe the course of the sciatic nerve. The lumbar region of the spine, vertebrae L1 through L5, is located between the thoracic and sacral spines. The lumbar spine includes 5 vertebrae and 5 intervertebral discs. Intervertebral discs are located between the end plates of the adjacent vertebral bodies. The end plates are the top and the bottom surfaces of the vertebral bodies that face the discs. The discs form the articulations between the vertebral end plates. Each disc, together with the end plates, form a fibrocartilaginous joint that allows for small movements and acts as a major shock absorber in the spine. The disc is composed of 2 discriminate parts: a tough outer circumferential layer and a soft gelatin-like inner nucleus. The inside nucleus pulposus is made up of mostly water and scattered loose collagen and proteoglycans that create a gel-like substance. The outside annulus fibrosus is composed of a number of concentric sheets of tough collagen fibers acting as a seal around the nucleus pulposus and resist forces placed on the disc. During movement, many types of forces are placed on the vertebrae and discs, including compression, torsion, and shear forces. The disc, along with the vertebral body end plates, form a clever load-bearing system. Compression pressurizes the nucleus pulposus, and through hydraulic mechanisms compresses the end plates above and below and pushes out towards the annulus fibrosus. As a result, the end plates and annulus fibrosus bulge, which dampens shock. The bulging of the annulus is accentuated with spinal bending. Muscles in the back and abdominal regions contribute to spine movement and its stability. They create movement by pulling the osseous anatomy into flexion, lateral flexion, extension, and rotation. The joints and ligaments around the spine guide this movement. While these are important in movement, when contracting together, these muscles form a corset around the spine, creating stiffness by compressing the vertebrae together and minimizing shear forces, keeping the vertebrae and the soft tissues surrounding it safe. Now that we've discussed the biomechanics of the spine, let's take a closer look at the sciatic nerve. The sciatic nerve, made up by the union of L4 through to S3 spinal nerves, leaves the pelvis through the greater sciatic foramen just inferior to the piriformis muscle and travels in between the hamstrings and the posterior thigh, branching into the tibial and common fibular nerves distally. It provides motor and sensory innervation for the leg and foot. Injury to this nerve or the roots that contribute to it will lead to symptoms along the nerve and its branches, which may include motor and/or sensory deficits.